Hello, my name is Dr. Stephen Porter from Mayo Clinic in Jacksonville, Florida, and I'm here today to talk about my JBJS article, TXA was not associated with increased complications in high-risk patients with intertrochanteric fractures. This is a follow-up study to work our group has already published on high-risk patients with hip fracture undergoing arthroplasty. We looked at patients requiring intertrochanteric fracture repair between 2015 and 2019 across Mayo Clinic. We identified high-risk characteristics on the patient side, such as a history of stroke, deep venous thrombosis, pulmonary embolus, myocardial infarction, atrial fibrillation, etc., and compared matched patients who did or did not receive tranexamic acid or TXA during their IT fracture surgery. In comparing matched patients who had high-risk features, we were not able to detect any signal that the administration of TXA increased the risk of mortality or serious complications such as DVT, PE, MI, or stroke. Why did we undertake this study? We felt that IT fracture patients were unique compared to hip fracture patients requiring arthroplasty because the surgical repairs are different, as well as potentially the surgical teams taking care of them. As there were fewer patients in this cohort compared to our previous JBJS study, there are still significant limitations to our research. As I mentioned in the last study, it is possible that there are unique patient characteristics that would change the safety profile of TXA administration. In order to answer this question, specific investigations would need to be taken to look at, for example, only patients with a history of stroke, only patients with a history of atrial fibrillation. And we were not able to power that kind of analysis. A very large data set may be used to answer those questions in the future, but those large data sets tend to be limited because they are based on billing data, for example, and lack the granularity of being able to do a deep dive into specific patient records. We hope that you found this article of interest, and we appreciate your time in reading it and watching this video. On behalf of the entire research team between anesthesia, orthopedic surgery, and health services research at Mayo Clinic, thank you.